safe order. Again, I want to reiterate, stay home, work safe. This order will take effect tonight, Tuesday, March the 24th at 11:59 p.m. We've both been working on this for the last several days. I and the judge will comment. Since last Friday, I've been in contact with mayors from San Antonio, Austin, Houston, and Fort Worth as we all discussed what we were going to do moving forward with this COVID-19 virus. Dallas declared their own emergency order on Friday. Dallas has over 100 cases. They have over almost a third of the entire caseload that have been diagnosed for the state of Texas. So we got together as a group of mayors, and the county judges got together with their respective partners to decide what we needed to do based on the information we'd been given. The purpose of this order today is to coincide with one that was done yesterday with San Antonio and is being announced at this very moment with Austin, in Houston, and Fort Worth. This order is designed to suppress COVID-19. That is the key that the medical professionals tell us needs to be done in order for us to move ahead and get back to as much normal life as we can. This order is for all persons with the following exceptions: emergency personnel, healthcare operations, groceries, social and charitable services, media, gas and transportation, financial institutions, critical trades, postal services, restaurants for takeout only, food delivery, home-based care, child care, those performing essential governmental functions. A person who violates a provision of this rule upon conviction will be guilty of a misdemeanor, and that is punishable by a fine of up to $1,000 or confinement in jail. This decision was not an easy one for me, for the judge, for any of us. We're dealing with lives versus livelihoods. The county judge and I worked together to receive input from our community, from all of our school districts, and from the business community in specific. Our counterparts in other counties and cities, and most important, our healthcare professionals. The judge and I have received a letter of support from all of the hospitals and physicians groups in El Paso supporting this decision. Our healthcare professionals are on the front line of this pandemic, fighting daily to protect our community from the spread of disease. And we must heed the advice of these professionals and take all measures to flatten this curve. Again, I reiterate, we're trying to suppress this virus so we can get back to normal. I would like to take this time to thank all the doctors and nurses who've been working round the clock to care for our community. We must all do our part to relieve the burden on our healthcare industry. We cannot afford to wait until our hospitals are overwhelmed to take action. We cannot wait until we lose a life to take action. We understand the burden and strain on small businesses across the community. I know that many of you are saying, is the cure worse than the disease? We've debated that. Again, this decision was not easy for any of us. It is important that the residents and businesses cooperate to make this effort as successful as possible to keep our community healthy. We need to continue to practice social distancing even while buying groceries. We've had reports of all these house parties that have been out there with multiple groups together. We cannot have those house parties or those social gatherings. It will not work. If you are sick with COVID-19 or suspect you are infected, you stay at home and you avoid public areas. You stay away from others. You wear a face mask to cover your coughs and sneezes. These steps will help prevent the disease from spreading to people in your home and in our community. The following symptoms may appear 2 to 14 days after exposure: fever, cough, and a shortness of breath. Do not go to an ER or urgent care facility, call first. If you don't call first, it puts the healthcare staff at risk. I want to bring you up to date on two other things. I had a meeting this morning, or a telephone call, with Fort Bliss. They're going to be following our directives as well, and they're going to quarantine all their returning soldiers on post, not out in the community, even if they have family out in the community. I also spoke with Mayor Cabada in Juarez this morning, and he reiterated what the governor had announced yesterday, Governor Corral out of Chihuahua City, that all events are canceled. The governor has ordered the closure of all restaurants, bars, museums, movie theaters, sporting and recreational events, spas, casinos, and churches. All non-essential activities have been shut down. They are closing Chamizal Park. And also, they want everyone to stay home and continue to approach suppressing the virus as a region. And as I've said before, we view ourselves as one region. I now want to turn the podium over to our County Judge, Samaniego, and then Dr. Ocaranza of the Public Health Department will come up to give you an update. Thank you.
Thank you, Mayor. You know, as I know I'm addressing to one of the best communities, one of the great communities in the country, and we have all the faith and confidence that you will adhere. We're very fortunate where we are right now, and it's by no accident. It's by the actions that our leaders have taken, and we thank you for that. We now have to go to the next phase, which will allow us to contain it and have the confidence that we're doing the best we can for our community. I would like to focus on the spirit of the order. There's a lot of ways that we could look at the ambiguity or try to resolve things or try to second guess things, but the spirit of the order is very clear. If you stay at home, if you work safe, we're going to be able to contain this virus, this insidious virus that's taking place. So look at that from that perspective. What is it that you could do to contribute to the process is by staying home, and I guarantee you that that's a huge effort on everybody's behalf. So everybody, every individual person needs to feel that they're contributing to the process. If we don't get that synergism, if we don't get that excitement by our community, then we'll face other challenges throughout. I would like to also call on every leader, whether you've been, you yourself as a leader, you've been sought out as a leader, every single superintendent, every single CEO, every person that has a leadership position should strive to take care of their entity, to be in communication with them, to motivate them, to get them excited about coming out stronger. So I reach out to every leader in the community to do that for each one of us as well. I want to thank all the partners. When you have the utilities, what they've done and how they're retracting from taking any kind of action. When you look at the superintendents and what they're doing, and the medical community, which I want to emphasize that the medical community is what's driving this whole process. Then we have to deal with the collateral effects of that process. We cannot do it the other way around. So I also want to thank the business community, the texts that the mayor and I have received in respect to supporting it. Everybody, you know, they do get hurt, small businesses get hurt, but we really appreciate the patience that it's either containment for a temporary time or we don't do the things we need to do, and then we're going to have a long-term effect and collateral effect in a lot of different ways. You know, we have to abide by these and adhere to these things, and the mayor and I have said, you know, we close the valve if the community doesn't respond. I know that's not going to be the case, but we did not have all the traction that we needed when people are gathering and going against the order. I would also like to say that in behalf of our judicial system, and this is on behalf of Judge Chu and the Council of Judges, that although we have closed the courthouse to the public, our district county probate courts will remain open. If you have a court hearing, please contact the Council of Judges, the court administrator, if you have any questions, utilizing our www.epcounty.com. So we didn't shut down the courthouse. We closed it to the public, but there's a lot of activities that are going on because I want everybody to know that you're in a very safe community, that the jail and the court system continues to move forward. We also realized, the mayor and I realize that we still have a heavy heart due to the 3rd of August, this tragedy. We know how hard it is on our community. We were called to unite, and now we are called to be individuals in this battle. And these individual efforts are going to take us to where we were strong. I can guarantee you we're going to be El Paso stronger. Finally, I'd like to thank the first responders and our healthcare workers who have been working nonstop to protect us. These heroes are doing everything they can to save lives, and we must do our part also. I also want to emphasize that this was not a random kind of a decision. The attorneys, our city attorneys and our county attorneys and all the back offices and all the people that work together, the sheriffs and everybody else, I can guarantee you that this was a very well thought out process. I really want to thank the mayor for our relationship that we have. We've aligned our orders. We're at the point of almost making one order, but we have different statutes that we have to sort of separate them. But I can guarantee you without a doubt that we're very well aligned and very well supported by our legislative council and also the senator, our state senator, Jose Rodriguez. So once again, I do want to thank all of you and all the community. We're going to go out there. We're going to come out better. Please adhere to what we need to the advice that we provide. And I want to give all of our community a huge air hug. Thank you.
Good morning. A stay-home order is a must process to stop the spread of the virus. It is a necessary step that we need to take in order to protect our community. We do have positive cases of COVID-19 in our community, and we will continue to see those cases rising, but our intention in providing this order is to keep everybody at home so everybody can stay safe, and ultimately everybody is going to stay healthy. We cannot afford to overwhelm our health services, and social distancing is everybody's responsibility. If you see somebody that is not observing that, please invite them to do so. We all need to stay healthy, and we all need to take care of each other. Please, we have been mentioning this over and over. We need to take care of our elders and make sure that they stay home and they stay healthy. Provide assistance to them. Help somebody in need, and that's the way that we are going to be able to continue staying healthy ahead of this epidemic, and we will be able to accomplish this with everybody's help. This is everybody's responsibility, so please take ownership of the responsibility and let's do our share to keep our community safe. Mayor and county judge have said it. We're all working as a community. As a community, we need to continue providing the same message and making sure that everybody is safe. It has been a very hard decision, but it's a necessary decision that we all need to take. Again, thank you to all the healthcare providers, hospitals, and everybody who plays a role in keeping our community safe. We will continue monitoring the status of the COVID-19 spread in our community, and we're working tirelessly to continue providing guidance, recommendations, and orders to be able to keep our community safe and move forward from this time on. I appreciate every single one of the residents of this community for all the help and all the understanding and for everything that you have done to prevent the spread of the virus. If you have come home from out of town, either from the United States or from abroad, please stay home. Monitor your symptoms. If you start feeling sick, call ahead, call your healthcare provider, and don't rush to the emergency room. It is extremely important that we leave the emergency rooms for the people that really need it. If you know somebody that is just arriving home, please invite them to stay home and do not gather in everybody's house. Very, very important. Please do not have high amount of people gathering in your home. Just stay home, stay healthy. We all are going to be able to do this, but together. We currently have 11 cases that are positive. 3 of them were tested somewhere else other than the city. And again, we will continue to see more positive cases as we test more people. Fortunately, all these cases are recovering at home, and hopefully we continue seeing this as a trend in our community, that we don't have to be seeing these patients getting sicker in the hospital.
I want to reiterate that this order takes effect tonight, Tuesday, the 24th of March at 11:59 p.m. That is when it takes effect. So how do we do the questions here? Okay.
Estamos aquí para darles una orden muy importante a toda la comunidad. Le estamos ordenando a la gente que se quede en la casa a partir de hoy, marzo 24 a las 11:59, va a entrar en efecto esta orden donde se les ordena a toda la comunidad que se queden en la casa, que trabajen de la casa, y solamente las personas que desempeñan una labor esencial van a poder estar en la calle. Les pedimos de favor tomar esta orden muy en serio. Queremos que la comunidad siga en buen estado de salud, y es la única manera que hemos facilitado el poder prevenir muchas complicaciones por la pandemia que vemos del virus del COVID-19. Tenemos 11 casos positivos. Muchos de ellos fueron hechos la prueba en nuestro laboratorio de la ciudad, y 3 de ellos se hicieron la prueba en algún otro laboratorio. Vamos a seguir viendo más casos positivos de COVID-19 en nuestra comunidad, y esa es la razón por la cual necesitamos que toda la gente acate esta disposición, siga las recomendaciones que le damos, y si conoce a alguien que no esté siguiendo estas recomendaciones, que no esté tomando en serio todas estas órdenes, por favor, invítelo a que haga todo lo necesario para estarse en su casa y poder evitar que esto se salga de nuestro control. Le agradecemos mucho a todas las personas que han seguido todas nuestras recomendaciones, y por favor, si tiene alguien conocido que esté llegando a la ciudad de fuera, invítelo a que se quede en su casa, que no esté yendo a visitar gente, sobre todo aquellos que vienen de Europa. Por favor, si usted tiene hijos o conoce a alguien que venga de fuera, que se quede en su casa, monitoree sus síntomas, y si empieza a estar enfermo, por favor, que le hable a su médico o pida más instrucciones. Es importante que toda la gente entienda que el quedarse en su casa no significa que van a hacer fiestas nada más en la casa. Estamos ordenando que la gente no haga fiestas o se reúna en grupos grandes en otras casas. Por favor, hay otras maneras de convivir con nuestros seres queridos, y muchas de esas maneras son medios virtuales que al momento estamos utilizando. Por favor, no lo haga. Le agradecemos a todos su atención y su cooperación con estas nuevas órdenes. La mejor recomendación para otros casos positivos que estén en Ciudad Juárez, sabemos que muchos de estos casos se recuperan sin mayor atención médica. Lo mejor que pueden hacer es quedarse en su casa. Al salir de su casa y sabiendo que son pacientes con COVID-19 positivos, van a contagiar a otra gente, sobre todo si no toman las medidas necesarias. Por favor, no lo haga. Hemos recomendado y queremos seguir mandando este mensaje a todo mundo para que siga las indicaciones y prevenir la expansión del virus en toda la comunidad de una manera descontrolada. The question was about positive cases that might be able to cross and get different medical attention in El Paso, especially coming from Juarez. Our best recommendation is that most of those cases are mild and can stay home and monitor at home. They need to follow the health authority recommendations that they have been given, and coming outside and traveling, knowing that they have a COVID-19 is going to expose a lot of people, and it's going to create a bigger problem, and the virus can spread a lot more and a lot faster without any control. Please stay home, and it is extremely important that they know that and refrain from traveling. If they're healthy, they can still exercise outside, but observing social distancing. It is not recommended that just because they're outside, they can all gather together in bigger groups. They can exercise. We have great alternatives that they can go hiking, they can go somewhere else if they need to. But again, observing social distancing and doing it, limiting the amount of time that they're going to be outside. This order is to stay at home. The most of the time they need to stay at home, and they need to be healthy that way. En español, lo que recomendamos es de que si necesitan hacer ejercicio afuera, pueden hacerlo de una manera moderada, pero también observando el distanciamiento social. El estar afuera no significa que se van a juntar con grupos grandes de personas y de esa manera evitar la orden de estar en la casa. Si necesitan hacer ejercicio, háganlo de una manera moderada, en la cual van a estar limitando el tiempo que van a estar afuera de su casa, y lo que necesitamos es que toda la comunidad esté en su casa, evitando el contacto con otras personas. El distanciamiento social es extremadamente importante en estas situaciones.
As soon as the health professionals tell us that we have suppressed this virus, it will be over. We're not sure what that timeline is. I would hope 2 weeks, certainly no longer than a month, but we don't know. And until the health professionals tell us where we are on this, and we just don't know. And the idea is that I had a discussion yesterday with the dean of the Dell Medical School in Austin, who's putting some models together on what this virus is doing to the communities in Texas. And he said, we're about a week to a week and a half ahead of where Austin is. So we are in a position to suppress this before the others, which means if we can suppress this, we can get back to work and normalcy sooner. And that's the whole point of what we're trying to do. I'll also add that this order will be posted on the city's website for everyone to see.
Muchas gracias. Me dan la oportunidad de expresar a la comunidad hispana. Es una gran oportunidad de decirles que es muy importante que sigan las reglas, que estamos haciendo todo para contener el virus, y parte de eso es no tratar de anticipar por lo pronto cuándo va a ser la fecha final. Lo hablamos muy seriamente porque nos gustaría dar una fecha, pero lo único que vamos a hacer es causar que las personas comiencen a decidir o a cambiar sus hábitos pensando que ya llega la fecha final. Es muy importante para nosotros entender muy bien el aspecto de los médicos, las personas que nos están avisando por el lado médico, para poder tomar una decisión a base de ellos y no a base de las situaciones que están pasando o la parte colaterales de la situación. Nosotros vamos a estar muy pendientes, muy cercas a los médicos para poder tomar una decisión más definitiva. Muchas gracias.
Well, we hope that people will voluntarily support this. Remember, the purpose of this is not to be onerous and restrictive. The purpose is for public health and to prevent the spread of a virus that is hitting the entire world. It is a misdemeanor, as I stated earlier. It will be punishable by a fine of up to $1,000, and we will enforce to the extent that we can enforce given our capabilities. But the idea behind this is that we voluntarily support this and move ahead so we can get this behind us, and the sooner we get this behind us, the sooner we can get back to normal. Well, I'm not sure I follow the question. Is what directive applies? It applies to the resident of those respective communities, whether you be Juarez or Las Cruces and southern New Mexico or El Paso. And as I said earlier, our directive is mirroring what Austin, San Antonio, Houston, and Fort Worth are doing. And the message has been sent to the governor to be aware of what we are doing. But it's wherever you reside is the dictate that applies. So.
La pregunta es que qué directivo vamos a seguir, porque tenemos el Nuevo México muy cerca, tenemos otros condados muy cercas, pero si ustedes recuerdan, el mensaje del gobernador fue darnos al alcalde y a mí como juez del condado el poder para tomar directivas. Entonces, cada comunidad, que sea muy claro que cada comunidad debe de seguir esas directivas para poder hacer lo que tenemos que hacer como una comunidad. Cada comunidad es muy diferente a la otra y las directivas son diferentes. Entonces le pedimos que sigan lo que nosotros estamos haciendo con esta orden y no tanto las órdenes de otras partes de Texas o de los Estados Unidos.
Well, the testing criteria is going to be set to categorize higher risk patients, but also with the drive-through testing that we're working on, the criteria is just to have some doctor's orders and you can get tested if your physician feels the need that needs for you to get tested. So there's the testing criteria that we follow to have a risk stratification on every patient because we're actively looking for the severity of the disease in our community, but also that drive-through testing is going to give us the ability to see the community-wide spread. And we are counting that we will find more positive cases, and the process is going to be a little bit different, but taking into account everything and every piece of information that we will be having. En español, el criterio que estamos utilizando para hacer pruebas de COVID-19 en la comunidad se ha relajado en cuanto a la manera que le vamos a hacer la prueba de este virus a la comunidad. Tenemos el servicio de drive-thru a través de su carro en el cual necesita la orden de su médico y si su médico considera necesario que se le haga la prueba, estamos en ese proceso de poder hacer pruebas a la comunidad en general, pero el otro criterio que usamos para hacer pruebas también lo usamos para la estratificación de riesgo en toda la comunidad. Queremos seguir observando muy de cerca de cómo se comporta la enfermedad de nuestra comunidad, viendo la severidad de cómo está atacando el virus a nuestra población y seguiremos poniendo esas piezas de información para poder dar las mejores recomendaciones y darle un seguimiento muy cercano al desarrollo de la enfermedad de nuestra comunidad. That is a very good question, and we are definitely challenged by having less healthcare providers per capita in our community. So we're having all healthcare providers pitching in, putting all their effort in trying to treat the patients as they need to, triage the patients, and doing other modalities of patient care like telemedicine to be able to take care of our community in that regards. So the message that we give to the community is, one, not to be scared. We do need to put orders in place like stay at home, and that's the only way that we're going to be able to mitigate the effect of the virus in our community. We are very concerned that if we don't take proper measures, our healthcare resources are going to be rapidly depleted, or we're going to be facing a bigger problem. Y en español, lo que tratamos de hacer en nuestra comunidad, al ver que tenemos muy poca personal de salud, médicos, enfermeras, tenemos que atender a toda nuestra comunidad y todos nuestros médicos, enfermeras y proveedores de salud están haciendo lo posible por darle atención a la comunidad. Hay muchos otros métodos en los que también se están utilizando como la telemedicina, en los cuales se utilizan medios virtuales para poder dar atención a esta comunidad. No queremos que nuestros servicios de salud se acaben o se utilicen de una manera exagerada y de una manera muy rápida. Es por eso que tenemos que establecer estas órdenes tan estrictas para poder mitigar el efecto del virus en nuestra comunidad. Mirroring what Mayor and County Judge said, we need to use common sense. We cannot be very specific as what construes essential traveling or essential services. We all need to pitch in. We all need to do our part in staying at home instead of looking for ways to go outside and do other activities. The message here is to stay home and stay healthy, is not to be infringing in our community's economy, in our community's daily life, but this is a necessary measure that we need to take, and we are asking the whole community for their common sense. We're asking everybody, each one of you at home, to put your part in controlling this. Y en español, lo que tratamos de hacer con esta orden es no ser específicos en qué constituye algo esencial y qué no. Lo que tratamos de hacer es mantener a la comunidad en buen estado de salud y queremos que la gente use su buen juicio. El sentido común es bien importante y no queremos que la gente se ponga a discutir o a ver qué se constituye como algo esencial y qué no. Lo más importante en este momento es quedarse en su casa para que de esa manera podamos controlar el virus y es responsabilidad de todos. Tenemos que seguirlo y no poner en riesgo la salud de nosotros o la de cualquier otra persona.
Well, the purpose of a stay-at-home is to stay at home if it's not essential that you go out for business or for groceries or whatever you need. So you have to make the judgments. This is it's as much a self-directive implementation as it is what we are providing with the parameters from a legal standpoint. But you all, people can still go back and forth. We're not changing the order related to the bridges or anything else. Juarez is to a great extent mirroring exactly what we're doing in the state of Chihuahua as well. So we're kind of all in this together, and if we together stop and suppress this virus, that the sooner we'll get back to normal and moving ahead. I can assure you that neither the judge nor I take this decision lightly. I spent 35 years in business as a CEO. I understand that the impact it's having on our community right now. It is a gut-wrencher literally for both of us. We understand, and we need to do everything we can to support those businesses. You need to go out there and buy gift cards. You need to go out there and visit those restaurants that are only takeout. Manage the social distancing, but still partake in our community to the extent you can.
Sabemos que estamos en una comunidad muy única, sabemos la relación tan fuerte entre nosotros y la comunidad de Juárez y todo Chihuahua, y es como dice el alcalde, que tenemos que ser razonables, que es esencial. Lo que queremos es que se queden en la casa o están trabajando vía telefónica porque están esperando otro directivo. Pero es muy importante que ustedes mismos digan, ¿es esencial o no es esencial de que yo esté afuera? Seguimos pidiéndoles que vayan a los restaurantes a sacar órdenes, que lleven a la casa, que la economía continúe. No les estamos pidiendo que restricten ese movimiento de tener que ir al mandado o tener que ir al restaurante a agarrar una orden para llevar. Tenemos que apoyar muy fuerte a la economía en donde se permite. Pero ustedes mismos van a tener que entender, ¿es esencial o no es esencial? ¿En qué estoy contribuyendo para estarnos en la casa? El papel que ustedes juegan con su familia, que si ustedes lo hacen, el resto de la familia lo va a hacer. Les agradecemos mucho que usen ese juicio que sabemos que tenemos para tomar una decisión ustedes mismos, ¿es o no es esencial?
Along those same lines, we understand that this is an economic impact across the board, and the federal government has said that they will provide some incentives and some reimbursements for businesses. So I want to encourage all the businesses out there to make sure you're accounting for all of your expenses and/or losses related to this stay-at-home work order. It is imperative you gather the data, save the receipts, send them either to the city's economic development department or to the county's economic development department, so we can try to make sure that everyone receives what they are entitled to based on what our federal government is saying they will do with the economic stimulus packages.
Sabemos que va a haber muchos fondos del gobierno y de diferentes agencias apoyando a los negocios que sufran dado al virus. Entonces es sumamente importante que mantengan sus archivos de los efectos, del impacto financiero que está causándole el virus. Por favor, entiendan que el gobierno está muy consciente de que tiene que levantar la economía, y la manera de levantar la economía es que puedan reembolsar los daños de este virus a los negocios. Vean, el SBA o muchas organizaciones ya están haciendo, la Cámara de Comercio Hispana, la Cámara de Comercio del Paso, todos están apoyando a los negocios para que ustedes puedan saber en qué manera o en qué situación pueden recibir fondos para recuperar el daño y el impacto del virus.
The question was about mortgages and rent payments and forbearance, especially if you're unemployed at this time. And the answer is that is included in our order, our previous order, as well as this order. There will be no foreclosures. Banks are withholding, are not going to charge for the interest rates. There's some forbearance there. I believe that everybody should be taken care of during this time, and the sooner we can get it under control, the less financial pain and suffering we will all deal with. But there's going to be no gouging. That was the order we passed last week. There's no gouging. There's no utilities will remain in force. There will be no closing of water or electricity or gas. Everything, we should be able to withstand this. And please get your information in related to expenses, but also if you need to apply for unemployment, apply for unemployment.
Si la pregunta va a ser que va a haber ciertas fallas como no poder pagar la renta o no estar al tanto con la hipoteca, con el banco, los servicios. Quiero que sepan, es una comunidad que ha respondido muy bien en el hecho que hemos mandado en parte de la orden, es que no pueden evitar a las personas de donde están o por falla de pagos a la hipotecaria, nadie va a hacer algo para prevenir eso. No queremos que ustedes ahorita estén pendientes de esas situaciones, lo más importante es que se enfoquen en su salud y no tanto en el impacto. Estamos haciendo muchísimo para que no haya ninguna desconexión de los servicios o que tengan que batallar con algo de la hipoteca o cualquier cosa relacionado a estar bien, estar en sus casas. Sabemos que mucha gente no va a estar trabajando, es muy importante que puedan aplicar para desempleo y hacer todo lo necesario para poder ustedes sostener y estar bien en la casa.
The question was about parks and hiking and the fact that California is closing beaches and other things. No, we are not closing any of our parks. You can continue to hike. You can continue to visit all of our parks. But the bottom line is we want social distancing. We don't want gatherings at those parks. That will be problematic, and it will defeat the whole purpose of what we're trying to do if you have big crowds show up at a park. You need to maintain social distancing, but the parks are open. And frankly, as I know, as we get stir crazy with all this that's going on, you're going to want to get out. And that's why we're making sure that the parks and our recreation facilities are available, with the exception of health clubs and the exercise facilities. They are not. No, none of the indoor facilities are available. It's strictly the outdoor.
La pregunta es sobre recreo y los parques y el uso de los parques. ¿Están abiertos los parques? El alcalde y su servidor pensamos muy bien esto porque tenemos que tener una oportunidad de estar buenos de salud. Entonces los parques, los lugares que pueden ir ustedes van a estar abiertos, van a hacer todo lo posible, pero sí les recuerdo que si no se utilizan bien, no hay orden, esto nos va a forzar a tomar otras medidas. Pero si ustedes siguen los reglamentos del doctor, de que haya separación, distancia social, no vamos a tener ningún problema. Necesitan ustedes salir, estar en el aire abierto y poder participar en esas cosas que ustedes necesitan. Ya que los espacios están cerrados, esa es la alternativa para ustedes. Pero no va a haber nada de recreo, deportes interno, todo va a ser, las oportunidades van a ser afuera, en el medio ambiente.
Right now, all the hospitals are doing a wonderful job, and the question was if we have enough beds in our city, in all the hospitals, to take care of the patients. And so far, the hospitals are doing a wonderful job keeping all those patients under their care. And we are doing these measures to prevent a surge capacity and getting to the point that we don't have enough beds and we will have to open additional beds. All their planning that they have communicated to us calls for some beds if the need arises to do that, but so far we're still in good shape as far as the hospital beds. En español, una de las preguntas era de si teníamos la capacidad en los hospitales de atender a la gente y todavía hay suficientes camas para atender a la gente enferma. Las medidas que se han tomado son medidas necesarias para poder evitar el que se utilicen todas las camas de los hospitales y lleguen a necesitar instalar camas adicionales de una manera emergente, pero las medidas que se han tomado es para anticipar y prevenir el uso de todas las camas de una manera muy acelerada en la que se tengan que hacer otras medidas de emergencia. Well, the death or fatality rate, we see many numbers from many other areas that have been affected initially, and the fatality rate for our area has been 0 so far. We are hoping that we continue that, and we're implementing measures to prevent fatalities in our community. And as we take care of our eldest, which he has seen that is the group that is mostly affected by death as a complication of the COVID-19, also the admissions to the ICU. Y en español, lo que hemos visto en nuestra comunidad de la tasa de fatalidad de acuerdo a este virus, hasta el momento tenemos una tasa de fatalidad de 0. Esperemos que la sigamos manteniendo en 0, pero seguimos vigilando cómo se comporta el virus en nuestra comunidad y esperemos que no tengamos ese tipo de complicaciones en nuestras personas mayores. Hemos estado mandando mensajes y dando las recomendaciones y órdenes con el objeto de proteger a nuestra comunidad más vulnerable, que son los adultos mayores.
If there are some concerns out there about noncompliance and you want to report it, dial 311. 311 for noncompliance.
Sí. La pregunta es que, ¿qué números, si ustedes ven que un negocio no está siguiendo los reglamentos, van a marcar 311 y ahí le pueden ayudar? De nuevo, espero que no sea la situación, pero es el número 311.
Question about impact on school closures. There's no change. The districts are handling they're handling this accordingly, and we have visited, our city manager visited with all the school districts this morning as well. I want to also remind people that for information, go to COVID compliance at elpasotexas.org. COVID compliance at elpasotexas.org. .gov. Excuse me. COVID compliance at elpasotexas.gov.
Sí, la otra pregunta era sobre las escuelas, que sabemos que es muy importante y es un impacto muy grande para la comunidad, pero sabemos que ahí es donde puede ser un mayor problema por el número de personas que se juntan, maestros, y entonces es algo que queremos mantener bien. Me acaba de informar la doctora Silvia Acosta del YWCA que las necesidades de guarderías para los niños es muy importante que traten de comunicar con ellas, están muy preparadas para apoyar en cualquier situación donde requiere que sus niños tengan el cuidado y estén en un lugar mientras ustedes trabajan o tienen otras actividades. El número en realidad es COVID compliance @elpasotexas.gov. G-O-V, por favor. Todo esto lo van a poder recibir en los sitios de nosotros, del condado y de la ciudad, para que tengan toda esa información. Lo que hemos hablado aquí, obviamente, si ustedes se van a nuestros sitios, ahí vamos a poder darles más información.
Okay, let me, the question about what constitutes essential businesses. Go to the City of El Paso website and review it, but let me reiterate what I said. These are the following exceptions, and it's better, it's elaborated in the order. Emergency personnel, healthcare operations, groceries, social and charitable services, media, that includes all forms of media, gas and transportation, financial institutions, known as also ATMs, critical trades, postal services, restaurants for takeout only, food delivery is exempt, home-based care is exempt, child care is exempt, those performing essential government functions is exempt. I'll also tell you construction, both residential and commercial, is exempt. You want to add anything?
De nuevo, el espíritu del orden va a ser muy importante, los servicios que puedan mantener nosotros, que siga la economía, que sigan las situaciones, pero más específico, todo lo que es el personal de emergencia, obviamente es muy importante, todos los relacionados con la salud, operaciones de la salud, lo que es cuestión de la comida como mandado, poder agarrar los mandados a las tiendas mayores donde hay mandado. Los servicios sociales que vienen haciendo de caridad, servicios de caridad, todos los medios que sean las estaciones, los medios de la televisión, porque esos son los que nos están ayudando con la visión y darnos la oportunidad de comunicar con todos ustedes. Lo que es gasolineras, todo lo que es relación de transporte, las instituciones financieras, los bancos y todo lo que nos ayuda a nosotros continuar tener la economía. Lo más importante, nos han pedido mucho, es la parte de la construcción. Esa es lo que le llamamos infraestructura. Esa infraestructura quiere decir que tenemos que continuar las carreteras, las casas, todo lo que estamos tratando de crear para el futuro. Es muy importante que todo relacionado con infraestructura en la construcción, eso sí no es parte de la orden.
I'm not aware of any documents that are required. We'll take you at your word for what you're telling, where you are. We're not going to have checkpoints throughout the city. This is a personal recognizance kind of a thing. We're trying to stop the spread of this virus by suppressing it so we don't have social contact. That is the bottom line. This is not martial law. This is not Checkpoint Charlie. We are simply trying to get ahead of this so we can get back to normal as fast as possible. So please understand that. Go to elpasotexas.gov to see what the order looks like, and it'll give you, I think, clarity as to what is there and what is expected. Use common sense. Don't go out and play pickup basketball games. That's not going to help. That's close contact. That's not what we want. We want people separated. Do the best you can when you're at grocery stores and you're in lines. Separate. Those kinds of things. Those stores are all open. Everything will continue. No need to hoard. I understand now that those who've been hoarding are trying to take it back, and the stores are saying forget it. But the bottom line is this is using common sense, and we know that the community of El Paso is capable of doing this, and the sooner we do this, the sooner we're out of it. No, and it does not have any impact on caregivers. Please, I reiterated that again, but you all need to, out there with questions, especially through the media, please read the document. It's only 3 or 4 pages. It's not long.
Sí, la pregunta es que qué documentos se requieren para nosotros tomar la decisión en los negocios esenciales, y no hay tal documentos. Es algo que nosotros tratamos de hacer, de estar asegurados de que esas situaciones que no son esenciales no necesiten estar afuera. Es muy diferente alguien que nos va a ayudar con nuestra salud, todo lo relacionado con la salud, obviamente ellos no van a estar abajo de esa orden. Pero es muy diferente una zapatería de que no se requiere, no es esencial, a una situación médica. Entonces, eso de lo esencial es algo que ustedes mismos van a tener que entender, pero la orden ahí es muy específica. Sabemos que hay una ambigüedad en la orden, sabemos que está la ambigüedad allí, pero también sabemos que hay cosas muy el alcalde y su servidor vamos a estar muy pendiente de las preguntas que nos estén haciendo y vamos a hacer todo a través de la rueda y de Facebook y otros medios, de ir contestándolas para que les ayuden a ustedes continuar. Nuestro trabajo aquí para alcalde, para mí, el doctor y todas las personas no se ha terminado. Nosotros seguimos dando la guía y el aviso para que ustedes puedan tomar las mejores decisiones.
Para más información y detalles, por favor visite nuestra página web epstrong.org y hay una sección especial donde dice Health Orders. Ahí puede usted accesar todas las órdenes, va a tener muchos más detalles, puede leerlas. Vamos a tener mucho tiempo para poder leer todas estas órdenes, pero estamos actualizando nuestro sitio y página web. También puede visitar todos los sitios de redes sociales a los que estamos mandando mensajes y estamos actualizando todas nuestras órdenes y recomendaciones. Well, what we know, and the question is about the projections and what the numbers are going to look like for the city. What we know is that the virus duplicates approximately every 5 days, or the number of cases can duplicate every 5 days, and it's better statement than the virus. But as we see numbers duplicate and we see the number of positive cases of COVID-19 starts behaving and it starts following the same pattern that we have seen in the United States and in other parts of the world where those statistics are being pulled out, we expect that we're going to continue seeing a lot of positive cases for the next 2 to 4 weeks where we are going to start seeing some of the peak on the epidemiological curve. We want to make sure that we don't have a sharp and very steep peak on this epidemiological curve, and we're trying to do all the non-pharmacological interventions, which is the hand washing and other preventive measures, which is closures of schools, which is quarantine or stay at home of all the groups at risk, which is at this point all the people older than 65, and also doing this order, which is stay at home order. All those combined are going to help us go through this curve that is going to be flat and not as sharp as we fear.
The city's going to look at what we can do to assist. We haven't determined yet, because we haven't met with council, on what our opportunities are or what's available to us. But we are looking at that right now. But the primary support for our businesses looks like it's going to come out of a federal directive with 3 incentive programs that they put together, and I understand they're debating one right now in Congress. So that's why I said we've got to you've got to have your records. What did this cost you? What did you spend? And get the information to our Economic Development Department as well as to the county's Economic Development Department so that we can go for those reimbursements. We realize that this is a significant economic, financial impact on all of El Paso. And we're very mindful of that. We were mindful of that before we made this decision. But the presumption is, our hope is, that by doing this, we have shortened the timeline that is going to be required to deal with this virus so that we can try and get back to normal as soon as possible. I want to remind everyone that the senior meals are still open. We're still continuing that. We're trying to be as normal as we can given this, but we've got to stop. We've got to have the social distancing to stop the spread of this COVID-19. And that is the key that everyone agrees to throughout the world. As Dr. Ocaranza has reiterated on numerous occasions, the bottom line is to stay at home, stay safe, and stay healthy.
Pues sabemos, lo hemos dicho, que sabemos que el impacto colateral de todo lo que estamos haciendo van a ser los negocios. Tenemos socios muy, muy fuertes, así como la Cámara Hispana, la Cámara del Paso, Workforce Solutions, SBA. Todas estas organizaciones están muy pendientes de apoyar a los negocios que están afectados. De veras les encargo que vayan a los sitios de estos, especialmente las cámaras de comercio, la Cámara Hispana y la Cámara del Paso. Hay mucha información para los negocios. Estamos haciendo muchísimo sabiendo el impacto que va a tener, pero mucho se está haciendo para prevenir más daños y va a haber fondos para apoyarlos. Estamos muy pendientes, tenemos el desarrollo económico del condado. El desarrollo económico de la ciudad está muy pendiente en cómo vamos a apoyar a los negocios a través de todo este tramo que estamos pasando.
Well, we're starting testing on the drive-through, which is going to give us information about community-wide spread. And that, the criteria is going to be based on the physician. If he feels that needs to be tested, then the people are going to get tested. We have limited resources, and that's why we need to base a lot of the initial testing to strict criteria set forth by the state and the CDC, where we were seeing a lot of the just symptomatic patients. We know that there's going to be asymptomatic patients, and those are going to be carriers that are going to be infecting other people. We are aware of that, and we know that that will happen. And once we start seeing all that spread in our community, we will take action on that. Y en español, la pregunta fue de cómo sabemos que no hay la dispersión en nuestra comunidad del virus si no estamos haciendo pruebas a los pacientes asintomáticos. Lo que vamos a hacer pruebas para toda la comunidad en general, que su médico piense que necesita hacerse la prueba, ahí es donde nos vamos a dar cuenta del impacto del virus en nuestra comunidad y qué tanto está habiendo de transmisión o dispersión en nuestra comunidad de este virus. Inicialmente, muchas de las pruebas que se hicieron a los pacientes son en pacientes sintomáticos, los cuales nos apegamos a las reglas y criterios estrictos que nos manda el Estado y el CDC para poder detectar inicialmente a los primeros casos que tenemos de COVID-19, pero también con la información que vamos a estar recibiendo de las pruebas que hagamos a la comunidad, nos vamos a estar informando un poco más de cómo está la situación de este virus y la dispersión comunitaria del virus.
In closing, I just want to reiterate on behalf of the of County Judge Samaniego and our Public Health Department with Dr. Ocaranza that we are concerned about our economic health, our social health, our educational health, and we're going to do all we can to make sure that we mitigate the pain and suffering that this is causing to our community. We will advocate on behalf of all in our community. Just give us the information that we can use to advocate. We will keep you apprised of what the federal government is providing, what the state government will provide, and what the city and county can provide. We recognize what we're going through as a community, and the sooner we can get through this, the sooner we can get back to normal. Thank you.